Madam Director, could you in 1 minute summarize for me what the recommendations are today from your agency about wearing masks?
Last Thursday, we released guidance that demonstrated for an individual who is fully vaccinated and not immunocompromised, that they are able to safely unmask, with the exceptions, certain exceptions, of course, in travel corridors, healthcare settings, that if you are an individual, you can safely unmask if you're fully vaccinated.
Inside and outside?
Inside and outside.
What about airplanes?
What is the policy on airplanes? The policy on airplanes is to wear a mask.
Okay. And why is it different on an airplane as opposed to a restaurant?
So the CDC provides guidance for what is safe to do. The federal policy is obviously an interagency policy that we need to look at across different agencies. What I will say, though, is that there's very little choice when you board an airplane as to who's going to be sitting next to you, who's around you. And also, airplanes may be a place where we have more variance because of the travel from international places.
I'm wondering when we can expect perhaps more detailed guidance for workplaces such as meatpacking plants and other crowded facilities where there's going to be a mix of vaccinated and unvaccinated workers.
Our National Institute of Occupational Safety and Health is working closely with OSHA around getting the best science to the Department of Labor, who has regulatory authority, but we are at CDC updating our guidance for the particular settings in light of the newer science.
Is this unnecessary for governors and mayors across the country to still keep a mask mandate in place?
One of the things I think that's really key in this is to recognize that we're not a homogeneous country, that there are some areas, that some counties that still have less than 20% of people vaccinated. There are some counties that still have greater than 100 per 100,000 cases in a 7-day period of time. And so I actually think, as I look at the map, a very heterogeneous map of how we're doing with cases, how we're doing with vaccinations, the decisions about whether to take off a mask mandate have to be made at the local level, have to be made at the community level.
Thanks for watching Bloomberg Quicktake Now. Subscribe to our channel to see the biggest stories the moment they happen from around the world. And tune in to our 24/7 live stream for global news coverage, interviews, deep dive shows, and documentaries on the stories you care about most.